What's up, y'all? It's your girl Justice here, and I'm back with another video. So, y'all, today I just wanted to let y'all know that your girl is tired. I had clinicals today, y'all, and I'm holding my phone, so y'all just bear with me if the camera is moving around a lot, cause I just prefer to hold my little tripod thing while I talk. But anyway, I had clinicals today, y'all, and it was just mentally draining. I had to do a lot of thinking. Usually in clinical, it's a lot of hands on stuff, it's a little thinking or whatever. But it was just challenging for me today because the patient I had today, he had pneumonia or whatever. So he had a lot of abnormal lab values, and my clinical instructor wanted me to figure out why his values was off, what to do to bring them back into balance. I had to first recognize that the values was off, then figure out why they would be off related to the diseases that he had and what he had going on. And it was just a lot. Like, I spent a lot of time on the computer just researching and just trying to figure stuff out. He did have a feeding tube, so I got to pass meds through a feeding tube, which was interesting. But pretty much what we worked on this week, because it's Thursday, so this is officially the last day of the school week, and I'm about to transition into the work weekend. That's how it go. But pretty much what we did this week in class was we did lectures on Tuesdays on wound care. So we going into wound care, and it's very interesting. Now, I ain't gonna lie, at first, before I started school, when I used to see some of the wounds at work and stuff, I used to always say, like, no, I am not gonna be no wound care nurse. I don't want to do wounds. I don't like wounds. All the things. I was like, no, I'm not gonna do it. But now that I'm actually learning about it and learning about just, I don't know, it's interesting. It's interesting, and I'm like, okay, maybe I can be a wound care nurse. Maybe I can travel around a little bit and just do wounds. But I don't know, because I done seen some wounds that's just real big, really bad, y'all. Like, you can put your whole arm into the wound. And it's just, and sometimes they smell, they drain. Sometimes you got to put like it's called a wound vac inside the wound, and it just suck all the pus and infection out. And I'm just like, But I don't know. It was interesting learning about it in class. I'm actually excited about doing some wounds to practice on. We practiced on Wednesday on some dummies, like just the fake people. We did the wounds and everything. I'm gonna insert some clips of us doing some wounds, which that was really fun. My classmates are hilarious. So right here, y'all, this is the dummy that we use and the sterile stuff that we use for the procedure for wound care. And right here, as you can see, my finished product, I packed my wound and I secured it. It was fun. But I didn't get to do no wound this week. Well, today in clinicals, I didn't get to do no wounds. A few of my classmates actually had they actually had some patients where they performed wound care on. I just didn't. My patient had a bunch of other stuff going on. But that's what we learned about this week, and we're also preparing for this huge exam next week. Y'all, when I say this probably one of the roughest exams that I have to prepare for since I done been in nursing school. It's just a lot of information, and my instructor really want us to know everything. Like, we going over lab values. Anybody that know, lab values are pretty much one of the toughest topics. And then the thing is, every place you go don't have the same lab values. Like, okay, they have a range, but what my school is teaching me is a abnormal range. I figured out at the hospital today that they have a whole different number that they claim is a abnormal range. So I'm like, everybody need to get on the same page with this, because this already challenging to learn in the first place. But anyway, so we got a lot of stuff. We learned about electrolyte imbalances. We learned about like I said, the metabolic system and the respiratory system, whether it's acidosis or alkalosis. I got the word right this time. Yeah, and on top of that, we just doing like developmental, the stages of developmental that you learned in psychology. We learned that in nursing, and then we had chapters about needle sizes, injections. You have to know all the signs and symptoms of the imbalances of the diseases of the electrolytes, all type of stuff. And it was like 10 chapters we had to read. We had to read them 10 chapters in a week to take the exam next week. And we read those 10 chapters last week. This week we started reading about wound care, and we're preparing for the exam next week for all the stuff we read. So on top of knowing all that information and studying for all that information, we have lectures on new information. Y'all, this is no joke. Like, this is no joke. But I'm not gonna lie, I'm enjoying getting the information. I'm enjoying getting the experience, you know, and I'm just gonna do the best I can. That's all I can say. But at the same time, y'all, it's what makes it really hard too is when you got like other stuff going on outside of school. Like when I get out of school, I'm in mom mode. I have to get my baby. I'm washing clothes and stuff, trying to get everything settled in the house to prepare for the work week, washing all my work clothes and everything like that. And it's a lot, y'all. It's a lot. And then I have to try to study, which I'm not gonna lie, I'm not gonna study tonight. My brain is tired. Like, that's another thing. When you in nursing school, just like with life itself, you have to know when to give yourself a break. Just take a break. Like, I studied last night. I've been studying all week. I work overnight on the weekend, so I'm gonna do a lot of studying. I'm not opening no book or nothing today. I got out of clinicals like at 3 something. I got home around like at 4 something. I don't know. And I'm not picking up no book or nothing or studying. My head hurts. Like, I have a legit headache. And I'm tired. So I just told myself that I'm gonna come home, I'm gonna relax. I'm sitting here thinking about now what I'm gonna get to eat, because I cooked yesterday after class, but I'm not gonna cook today. Me and Dylan gonna get something whenever he wake up, or I might wake him up, because that boy will literally sleep from the time he get out of school to like 12 or 1 in the morning and then go back to sleep. So I ain't gonna let him sleep that long. Yeah, I just want to let y'all know to close this video out, because I ain't gonna be on here too long. Just know when to take breaks. Like, life be lifing. Like I always tell y'all, life be lifing. School be schooling. Bills be billing. Work be working. So make sure you take breaks. Make sure you take breaks for yourself. Relax your mind. Go outside. Like, whatever you do. I'm trying to start back getting into working out, because that really was like releasing me. I would feel so good when I worked out. Like, I would have more energy. But I just have not had time. I have not had time to work out, y'all. And then it's like when I do say I'm gonna work out, I be studying. I end up studying, you know, on YouTube, trying to find resources. YouTube got a lot of resources for pretty much everything. Like, YouTube is really good, y'all. But yeah, that's all I want to get on here and talk about today. Tell y'all a little bit of how the week went. You know, what we got coming up and everything. Thank y'all for watching my video. I want y'all to please like and subscribe, and comment down below and let me know some things y'all do to just release your mind when you tired or overwhelmed. What you do to take breaks, to give yourself a break. Like, what you like to do. Maybe I can try to incorporate some of that, because your girl is tired. But thank y'all for watching my video. I love y'all so much, and I will see y'all back in my next video. Bye.